Okay, so for this very special episode of Taking Control of Cancer, we are actually live in the at the UK Oncology Forum in Harrogate, a little bit closer to my part of the world, and we're going to be talking about what's going on here, and also why the alliances, and it's alliances rather than just one alliance here, why the alliances are all here together working a little bit more collaboratively. So we've got with us today Wayne Douglas. Hello Wayne, you're the Programme Lead for Diagnosis and Treatment at the North East London Cancer Alliance.
Hi Steve.
Hello mate. We have Rosie O'Dea, who's a Project Manager on the Diagnosis and Treatment team. Hello Rosie.
Hi Steve.
And we have from the GM Cancer Alliance, the Greater Manchester Cancer Alliance, we have Senior Programme Lead Molly Pipping. Hello Molly.
Hello, thank you for having me.
Well, it's really good to have you because I do a lot of work with you guys at the GM Cancer Alliance as well, and I know, you know, from talking to you guys and talking to Paul and talking to the guys at North East London, you know, the way that alliances work is fantastic. And this conference, I guess, you've all just come out of a meeting where you've all just been talking about how to work more collaboratively together. Easy for me to say. Before we start that, Wayne, just want to tell me a little bit about this conference, what it's all about, and also, you know, why the alliance is here.
Yeah, for sure. We came last year as well. They had the last year's one was in Brighton, and I think there's twofold for me. It was the first one we've come to, so initially a little bit apprehensive, but what we saw, we had a similar conversation like we had today, a bit about collaboration and how we develop a little bit outside of what national priorities are, because we've already got meetings that focus on that, but more about some of the localized pieces of work that we really wanted to kind of focus on. And then I've brought some of my team along today because there was lots of really good presentations, so I'm looking forward to hearing from others across a number of the fields or tumour sites, I should say.
Molly, from your point of view, as I said, you just come out of a meeting of all the alliances. How much are you guys kind of open and like looking to learn from other alliances in the way that you all do things?
Yeah, absolutely. I think that it's the only way that we're going to learn, and the population that we serve, we all have slightly different makeups to that, and I think there's a lot that we can learn from each other in terms of that space. But maybe I think it's a bit of a sense change for us as well. In previous years or up until now, maybe we haven't got it quite right, and we have all been working a little bit more silo and in isolation, all trying to make sure that we can be the best and we can diagnose earliest, and you know, we're at the tops of those tables. But I think that given where we are and the changes that happen in our system, it's more important than ever before that we embrace the change and see how we can support each other and share that knowledge and best practice.
I think it's really all about learning, right? So one of the things we've noticed about the Greater Manchester Alliance is about the educational development and how much you've emphasised that for both, I think, for patients as well as healthcare professionals. And we've started to kind of grow that from learning from what you've done, and yeah, we're in awe sometimes because of how big it is, but you've taken time over that, right? It's built over a number of years. North East London Cancer Alliance is the youngest of all. We always like to plug that because it was just after COVID that we were born, essentially, yeah. or split from North Central. So, but we've got to learn. We've got to kind of come together, and a lot of the conversation today actually was about how do we collectively kind of respond to the cancer plan and what's going to be coming out from that, and what are our views, because there is a national cancer plan, there is a 10-year plan that's meant to be coming out, and how do we collectively kind of influence that as a group of cancer professionals?
That's interesting, isn't it? 'Cause I know, obviously, Molly, you said that, you know, there are different challenges in all the different areas, but I know from working with these two alliances, there's actually quite a lot of similarities too, a lot of diversity in the populations, a lot of socio-economic challenges in various parts of your areas too. I guess like for you guys, Wayne, being such a new alliance though, you must have had to take, you know, bits from all the other 20 whatever it is alliances, you know, who've been established a bit longer.
Yeah, we had to learn. We were joint with North Central London as well, so we took quite a lot of their approaches to everything in the first instance, but naturally as you grow you start to kind of look out and understand what else is out there, and I think one of the real positives from I've been working in the Cancer Alliance now for 2.5, almost 3 years now actually, this month, and I value that kind of share and learn approach. There's no one that we struggle to kind of reach out to, and I think every alliance is happy to kind of show what they're doing, and I think that's great for collaboration going forward.
Rosie, what's your kind of impression of this conference, and what have you kind of taken from the initial meetings that the alliances have all been having together?
Well, I thought the meeting we had this morning was really, really positive, actually. And I think it's good when the alliances come together to prevent us, reinventing the wheel, learning what's gone well in one alliance and how we can kind of adapt that to suit our population as well, I think is really, really important. Learning about what those challenges are so that we can kind of anticipate them and roll things out really smoothly.
When you all get together, do you all find that actually you've come to some of the same conclusions? Do you find that you're all kind of thinking in similar ways?
Yeah, absolutely. And I think that the more that you speak, sometimes we all go to the same meetings as well, and we are all having the same conversations. I think, like you said, Rosie, it's just adapting it to make it fit for the people that you serve and the patient population that is unique to your area. I think that from my standpoint, and you've mentioned this, Wayne, that my area that I work in is workforce and education predominantly, and I lead our cancer academy locally. And like you said, we have a plan that we have to deliver on, but it's how actually, when we all come together and we sit in that room, how can we bring different ideas together where we might feel like something doesn't go far enough? And one of the areas I think that is a real testament to that is the portfolio that we've developed in Greater Manchester, and it might sit on our website and it has the GM logo on it, but it's definitely not owned by us. That is co-shared by everyone, and it's about working together in that space and, like you said, not reinventing the wheel, making sure that we can use money in the most effective way, stop that duplication, do what's right by our workforce and our patients, like reducing that inequity. But cancer doesn't respect boundaries. So why should we, just because we're in a different cancer alliance, why are we doing something again, just doing it in a slightly different way, when there's something there that we can do together?
We are all facing similar, if not the same challenges. There are nuances, of course, across the country, but workforce as an example, we just don't have enough staff for a lot of our professional disciplines. So I think there's an element that we need to kind of learn from each other. What are you doing? What are the differences? And that's why we're kind of keen for today. We're working with innovation, and we want to kind of identify technology out there that can really minimise the kind of impacts from a workforce perspective. But you're right, I think we are trying to break those boundaries. I think that's one of the benefits of the Cancer Alliances is that there is the national priorities, and we absolutely will deliver those, but actually we've got that ability at the moment anyway, at least, to really reflect what the local challenges are and how we utilise some of our resources to really focus on that, and building the academy in Greater Manchester is a good example, and stuff that we're trying to do in North East London.
So if we talk about innovation then, obviously Rosie and Wayne, your areas are diagnosis and treatment for innovation, more education maybe thinking about for you, Molly. But what have you seen here that excites you? Where are we with the kind of innovation in your different areas?
So I think what we're doing in North East London, I'm hoping will inspire and excite other people as well, if I'm honest with you. We've got a video that we've just designed, because I think one of the things for me, for a patient, is a lot of the work that we do is unseen, and therefore they will just see the outcome, which is absolutely fine. I understand that, but we're trying as much as we can to improve our cancer services, and I think it's an important message for our patients to understand and hear. So for me, I think from North East London, we're looking at how we communicate better with our patients and using kind of clinical animations to explain their procedures, so their treatments, but also explaining the pathway that they're on, or the cancer journey that they're on as well. But I think for this week, I think I've seen, for the next couple of days, I've seen quite a lot of talks that will interest us around the skin pathway. We're doing a lot of innovation around teledermatology and taking pictures in a different way. We've also got Natera, who we'll speak to a little bit later, who are developing a piece of work around our treatment aspect of cancer care as well. So there's lots there. There's lots of organisations out there. There's a couple here that we've worked with before, and we know Oncoflow is another one. So there's lots of really good innovators here, and I think it's about how we can collaborate and understanding our challenges and how we can work that through.
Rosie, what have you seen here that excites you? We're sitting in a room here just off the main exhibition hall, I think, aren't we? And there's loads of exhibitors all kind of showing off their technology and their innovation. What have you seen that excites you?
Yeah, I'm excited to go and have a more in-depth look. For me, today is kind of meeting people in person, and you forget the actual impact that has, and just kind of, you know, talking to people, the networking side of things. I think we've done quite a bit of that this morning, which has been great. I'm excited to go and have a look at the stands and kind of see what innovation is out there. I think as well, just listening to our clinicians and our patients, we have in the back of the mind some of the challenges that they're facing, and actually seeing some of those solutions during the exhibition will be really exciting.
Molly, what have you picked up on here?
I think that there's going to be a lot of talk about AI, and actually we're all at quite different points with it, and whether that's around treatment variation, performance, imaging analytics, or bringing that into the education space. I think there's probably a lot that we're all at quite early stages in different areas, but how can we learn from each other, work in that space, share our knowledge, without going down a complete AI rabbit hole.
Where could it be used in education then? What are the potential? I know you probably haven't gone too far down that road yet, but what are the potential? Well, I wouldn't be surprised, because I know how good you guys are. But you know, what are the potential uses of AI in your area?
So I think that we are at the beginning of it, but we've leveraged technology to create an AI variation of communication skills training. At the moment, I mean, it's not very conventional, I will admit that, and we need to do a lot more academic research around it, but it's about how we can create scalable and sustainable solutions, and that's not just for our Greater Manchester population. Actually, how can you lift and shift that so that other cancer alliances can utilise the same product? Like you said, we are all facing the same workforce challenge. There isn't enough money to put people through the essential communication skills training that they need. So what can we do to look at time and efficiencies in a different way? So people can log on, they can have a chat with these AI simulated patients, whether it's a patient or a carer. You know, that might be around breaking bad news, de-escalation, doing a holistic needs assessment. So yeah, there's huge possibilities for it, and you can go back to it as many times as you want. So there's so many different ways you can use it. I think it's just also, you know, it's great from a cancer perspective that we can share that with our cancer workforce, but we're also expecting so much more from our workforce in general. We want them to be really, truly multidisciplinary. We want them to know a little bit about everything. They need to know about mental health as well. They might need to, you know, that might be your maternity support worker and someone who's recently been diagnosed with cancer. And, you know, cancer isn't, they don't learn that at university. So actually, how can we adapt it and make sure that it really represents our system and what our workforce need? And that isn't just something on a Greater Manchester level, that's a national level. So
absolutely,
I'll speak to you later, Wayne.
Yeah, indeed. We're doing a lot similar with AI. We've got stuff coming up around conversational AI and how that might help and break down some of those barriers of the questions patients might ask, and they sometimes don't want to ask that for a number of reasons. It could be religious challenges. It could be anything really. There's lots of cultural challenges, should I say, rather than religious, but lots of challenges that mean that people may not want to ask those difficult questions, particularly when they're going through such a traumatic experience. I think really, particularly where you've identified that you've got cancer and then going through the treatment. So yeah, we're trying to use conversational AI to really ask and answer some of those questions that they would contact their CNS, their clinical nurse specialist about. But sometimes, unfortunately, they're extremely busy. We don't have enough. It feels like we never will. I'm not being pessimistic about it, but that is really the truth about it at this moment in time. And how can that chat really reduce some of those frequently asked questions? How can we have a patient at midnight, I think, thinking about their bowel prep the following day and making sure that they've answered all of their questions so they don't cancel the appointment, or actually they just want to change it and they can't get in contact with somebody. So actually, can we use conversational AI to arrange that and change that appointment for them at a more convenient time? So anything that we can do to kind of bring the patient back to that fore and put them in control.
Is AI very obviously much more of a part of this conference than it was last year?
Yes. Yeah, for sure. I think last year we talked about technology, but I think AI is just, for me, particularly in the cancer world, and I think, like you said, I wanted to talk about it earlier today actually, but we got into so many other things, we just didn't have enough time. But I think AI has grown quite substantially in the last year for me in North East London, and now we're really looking at that, about how it can help. And I think it's not. I think the catalyst probably was COVID for healthcare, and now we start to look at technology in a completely different light, and so that's growing the focus.
Because it feels, Rosie, like diagnosis and treatment, the area that you and Wayne both work in, that's what feels to me anyway, that's one of the main areas for AI so far anyway.
Yeah, absolutely. Currently, we're working on a project for skin AI, which will kind of help speed up diagnosis for patients and kind of deliver care closer to home, really, in Barking and Dagenham. So that's quite an exciting project that we have going on. I think you're right, it does fit in with the diagnosis and treatment portfolio quite well, but I think, you know, the possibilities are endless with it. There's some really, really innovative stuff kind of on the horizon, I think.
I was chatting to Paul Thomas from the Alliance before, and he said last year when you all met up, it was a bit more informal. There were a bit more of an informal conversation. This year, far more people, much more formality to actually the sharing, the session that the alliances all had together. How was that compared to last year? And is that kind of a bit of a sign of things to come in how much the alliances are working together, how much they're valued by the bigger ecosystem as well?
I think so. And I'd say there's probably double the amount of people and from a broader range of roles as well. Which shows there's an appetite for it and probably a lot of more awareness within our cancer systems that we do need to be sharing our knowledge. I think that we have a national drive to do this as well. You know, we don't know what the future looks like, so we need to make sure that we can support and prop each other up in a different way. I think that the next time that we're going to get together is the national event that we're hosting in Greater Manchester in September time, which will hopefully give another opportunity. But I think it probably just highlights that we can't just do this once a year. We need more opportunities and probably to an extended group, as we were talking about the value in the voices in the room. And, you know, not everyone was represented today from the 20 cancer alliances. So just making sure that you have that in terms of equity as well, I think.
Yeah. It's certainly grown from last year for sure. I think the informal element is quite helpful. We have lots of forums already, but lots of that is online, and so actually there's a benefit of that face-to-face interaction and that conversation. I just think you get that richness that we were lacking, and you're right, probably once a year isn't enough actually.
So what happens then, Rosie, after all this? This all finishes at 5 or 6. Do you all get together and you all go out for dinner and it all gets a bit messy, or what happens?
I don't know. This is my first conference.
This is your first one.
We'll see. I'll
We'll
report
see
back. I'll report back.
You two then, what happens after hours at these conferences?
Yeah, I think we will go for a nice little meal.
Do you talk shop or do you switch off?
Well, yeah, you talk shop a little bit, of course, but I think it's also about building those relationships with each other on a more personable level, because, you know, I hope that we'll get to see Rosie again at the next UK Oncology Forum. And, you know, I probably will connect with Wayne outside of this meeting, and I wouldn't have done beforehand, so it already...
If we hadn't seen you in the corridor.
If you hadn't had me in the corridor...
And grabbed you and say, come and join our podcast now.
Exactly.
Well, that's why our corridor conversations are so important to
Indeed.
things like this.
Sure.
You know, you don't know what kind of problem you're going to solve in a corridor when you just kind of get together informally as well. So, yeah.
It's the energy, though, as well, isn't it, that this brings back into it. When you connect with someone and you can share what you do, it brings your passion forward. They have the opportunity to do the same for them, really showcase where they're leading. I can take this back to my colleagues in Greater Manchester. You guys can do the same. And also that's how we connect. And then it's like, oh, you'll know someone who's doing something else. And it will snowball quite naturally. So I think the power is in these conversations.
You touched on the kind of, without going too much into it, the kind of uncertainty around finances and all those kind of challenges. Does that kind of stuff make this kind of thing even more important?
Yeah, absolutely.
Yeah, without a shadow of a doubt. I think that's what kind of, we're all facing a similar challenge. So again, it's about how are we navigating our systems to really improve that, and what can we do collectively again to champion the cause of cancer and why we think the work that we've done has delivered so well. I think nationally, from a cancer perspective, we've delivered on a number of those kind of key metrics for patients, or improved significantly across, and that's really important. But actually what's more important is how it feels for patients, and I think we need to do more of this to kind of bring that to the fore for them.
Just to wrap up, Wayne and Rosie, I wanted to ask you just a bit more specifically about some of the work that you guys are doing in North East London and the the innovation, the technology that we're going to be seeing, hopefully not just the next year, but the next 5 or 10 years. Just give us some idea of some of the projects that you're working on in terms of innovation and technology.
Yeah, sure. So talked about conversational AI and how that might help us to break down some of those cultural barriers and speed up diagnosis or attendance at appointments for sure. We're working with Natera, we're going to speak to shortly, but they're working on our treatment element and how we reduce the number of treatments patients need if there is no benefit for ongoing kind of chemo support. So Rosie's is involved in that as well, and you've been doing some work on the skin cancer pathway as well, haven't you?
Yeah, absolutely. So we've been working with a company called Isla, where patients can go to their GP, they can have a photo of a suspicious looking mole taken, and that's then shared via the Isla platform with the dermatologist at the Homerton who review it. So it kind of eliminates one of the hospital appointments that patients may need. It gets them peace of mind quicker as well, and it also helps to free up dermatologist capacity as well. So that's quite an exciting project that we have. And I've touched on the AI project for the skin cancer pathway in Barking and Dagenham. That's another one that's going to kind of speed things up for patients to give them that peace of mind quicker and also free up some dermatologist capacity too.
What's the kind of one thing that you think is going to kind of make the biggest difference in improving cancer outcomes in the UK, but also in your neck of the woods with the challenges that you guys have got?
That's a tough question.
Because blame Paul for writing it.
No, I agree. Because I think it's component parts. So the cancer pathway has lots of challenges along the patient's journey, and actually, for me, probably the biggest challenge I think for me is about making sure patients understand that pathway, understand what's happening, and they feel in control, because it's about self-management as much as we can. The biggest change potentially, I think, maybe it actually is the conversational AI stuff, because I think there's lots we can do with that, and that really puts the patient back in the center of the conversation. But I also think, like I said, there's component parts. So we've got stuff that's on the diagnostic end, which will speed up and are really important, and equally when we get to treatment as well. So yeah, really tough question.
Molly, what's exciting the GM Cancer team at the minute?
What's exciting us? I think even in light of there's a lot of uncertainty, I think it brings so much opportunity for us, whether that's, the topic that we're talking about today around collaboration, whether that's looking at new innovations, but I will come at it from a workforce perspective. And for me, I just think that we can't deliver that best patient care unless we have a well-resourced and educated workforce. So making sure that we can do what we can to overcome those challenges and make sure that they are well-skilled and they have all of the tools that they need to provide that best patient care.
Wonderful. Well, thank you all so much, Wayne and Rosie, and thank you, Molly, for joining us.
Thank you.
Thanks for having us.